Hi, hello everyone. I think we're all set. This is Danny Neifert, and I am the creator of Skin Harmonics. It is the very first Medi-Holistic skin resurfacing method with a dedicated skincare line. And today I want to talk about hyperpigmentation. Now, one of the most important things to understand about hyperpigmentation is that this is something that is a symptom of a bigger problem. And so when somebody comes to me and they want to fix this, more often than not, there is a lot that has to be revised about their home care regimen so that their skin is not in a deficit and isn't gathering, these hyperpigmentation spots. So the basics, the Skin Harmonics basics are minimal cleansing, minimal exfoliation compared to what is normally, acceptable. There's a lot of daily exfoliation that's happening with most skincare regimes at home, and this is something that actually causes hyperpigmentation to take place. Like over cleansing and over exfoliation is one of the biggest causes of why our skin can hyperpigment. So we have to reverse that and get on a program that is doing minimal cleansing and minimal exfoliation once a month with an enzyme is the best way to exfoliate our skin. And then, the other main thing about hyperpigmentation being that it's a symptom of that there's not an adequate, truly nourishing skincare routine in place is that there's something called rebound hyperpigmentation, and it happens when we all of a sudden want to fix our hyperpigmentation. We want to fix it now, and we get lasers, we get chemical peels, we get microdermabrasion, microneedling. Now, all of those things might, if you're lucky, temporarily lighten your pigment. But what happens is this rebound hyperpigmentation effect where after 6 months or a year or a few years, depending, the other shoe kind of drops and the pigment comes back worse. And it comes back worse than you had it before. Because, of course, all of those procedures cause a breakdown of natural pore function, a complete destruction of our natural acid mantle, an imbalance of oil production, and sun sensitivity, and dehydration. So it only makes sense that all of those conventional treatments are going to cause this rebounding effect when it comes to hyperpigmentation. So the main thing to know about hyperpigmentation, as I'm trying to sum this up, is go to a very gentle and truly nourishing home care routine. I'm a big, huge fan of dermal nutrients, which is a way of feeding our skin in order to make new skin cells so that we're not relying on trauma for this. And we're doing this along with the gentle cleansing, the minimal exfoliation, hydration, barrier restoration, so that our skin can slowly, in time, push this pigment up. And of course, this is combined with minimizing sun exposure. So I sell a UV blocking serum, and I also sell a serum, another specialty serum that has adaptogens in it topically, which are very, very useful for fading hyperpigmentation. And then there's a vitamin C powder, which is really helpful in going this extra mile for the things that we can do for stubborn hyperpigmentation. And then this final thing that we can do is giving our skin like super doses of a really active niacinamide. It's kind of a trendy ingredient right now. I first heard about it about 15 years ago. And I think it's pretty cool that it's finally just now making its way into mainstream and the conventionality of skincare. So that's something else that I can offer in this as we're trying to very specifically target hyperpigmentation and target it in a way where we're not going to have this relapse effect. And, you know, I do also want to say that in certain cases, this there could be like small amounts of laser treatment. I would never recommend lasers for an entire area at all. But in some cases, you can laser in tiny areas to spot treat very specific places, and of course that needs to be followed up with nourishing our skin, you know, very deeply with the dermal nutrients and everything that I've been talking about to minimize the sun sensitizing that happens when we involve any kind of trauma procedure. Let's see, I'm trying to think what else I want to share about hyperpigmentation. Sometimes it's melasma and it's hormone based and it'll pass. But, you know, just really doing these things that I listed out in the right way at home can make a huge difference. And of course, the biggest thing, I mean, night and day difference, if you just know about them. And then the other thing about hyperpigmentation is that it can't be fixed overnight. It just can't. And if you do get an overnight fix, know that it will very much likely be, you know, followed up with this rebound effect. So I've had a lot of success with treating it in this slower but more steady and sustainable way. So yeah, I think that's kind of all I can remember for now about the hyperpigmentation. And I will just see you guys next time.